Hello, thank you for tuning in to this video proposal on the use of a DASH Diet mobile application by Lania John, representing Bradman University. What is the proposal? To utilize a dietary approach to stop hypertension, or better known as the DASH diet. Mobile application to increase African Americans' adherence to the DASH diet in the community. Therefore, decreasing high blood pressure and decreasing obesity. What is the problem? Well, hypertension disproportionately plagues the African American population as compared to non-Hispanic whites. And looking at these statistics, African Americans are more likely to have high blood pressure and less likely to have a controlled blood pressure. 30% more likely to die from heart disease. Complications of high blood pressure include, but are not limited to, stroke, heart disease, and kidney disease. These problems are costing Americans billions of dollars. But African Americans are not just affected by hypertension disproportionately, they're also affected by obesity. Obesity is also a risk factor that contributes to the prevalence of hypertension. African Americans were shown to be 1.5 times more likely to be obese. Oh, what's the good news? Having high blood pressure is not a death sentence. I repeat, having high blood pressure is not a death sentence. These risk factors are significantly reduced when blood pressure is decreased. Stroke is decreased by 37%, coronary heart disease by 21%, deaths from cardiovascular disease by 25%, and deaths from all causes, by 13%. How can we help? Well, these findings establish the need for the institution of interventions that are directly targeted at this population that will decrease weight loss and decrease blood pressure. The seventh report of the Joint National Committee on Prevention, Detection, Evaluation, and Treatment of High Blood Pressure support the DASH diet in the management of hypertension. This diet was proven in a random control trial to substantially reduce blood pressure and effective in weight loss. However, subsequent studies show poor adherence amongst African Americans. The greatest drop in blood pressure were experienced by individuals who showed greater adherence to the DASH diet. African Americans in this trial reported lower adherence to the DASH diet than Caucasians. This suggests that African Americans need interventions to improve compliance. In another study that explored the barriers of African Americans to implement this diet, it showed that one of the factors were the participants said they were unfamiliar with the diet food list and the food choices. What mobile application will solve this problem? The unfamiliarity with food choices and increased adherence among African Americans to this DASH diet that is so desperately needed in this community. The DASH diet food checker. Healthcare professionals can encourage patients to help themselves by checking compatibility of food items with the Dash Diet Food Checker. This mobile device is at the fingertips, downloaded to the mobile telephone. This gives a practical guide to patients while they're in the grocery store or at a restaurant. Let's look at some of the aspects of this application. The Dash Diet Food Checker allows consumers to input what food they want to buy and see if it is compliant with the Dash Diet. This addresses the problem of the Dash Diet pamphlet limited list that is not culturally sensitive to African Americans. This could potentially solve the problem of African Americans not being able to relate to the food items on the Dash Diet protocol. African Americans can run typical food items such as collard greens through the database to see if it's nutritionally sound for the DASH diet. The application also breaks down foods into categories. The application also allows for consumer feedback. The application gives an email address that consumers can add food to the application. The company in turn adds food to the list through updates of the application. This application is available on the iPhone 4 or higher and iPad. Working at the intersection. Or another way of saying it is a collaborative effort. The presenter chose to interview a medical doctor that was familiar with the DASH diet and had prescribed it for some of his patients to get his feedback on this application. She also chose to interview a family nurse practitioner who also prescribed this diet for her patients and to give her feedback from her discipline's perspective, and also a dietitian. Because this application is related to diet, and who better than a dietitian to give insight on diet? Insight offered. Ethical. The collaborator found no ethical issues with using the application because the application was not feeding back any information to the provider. Social. Well, the dietitian felt that the older patients might shy away from the use of technology, but this application would hit home with younger users. While the family nurse practitioner thought this technology was user friendly and could be easily taught to computer illiterate patients. This difference in opinion can be attributed to the nursing's discipline focus on patient education and self efficacy. The MD believed the application was socially useful. Financial. All providers found no financial issue or burden of cost with this application. What was learned? Mobile technology would be backed by healthcare providers as long as the information is valid and reliable. Healthcare providers want to guarantee the application they endorse are verified by specialists or research. In this case, they wanted a dietitian to verify the database. They also agreed that this application could provide a good resource at the fingertips of the patient as compared to a pamphlet available now. More research needs to be done on this application, or healthcare providers need to create applications for patients. What makes this project innovative? Integration of different perspectives. The dietitian's perspective is looking at a nutritional standpoint. Is this application nutritionally sound? The MD perspective, will this aid in treating illness? The family nurse practitioner perspective, will it help customize the care plan and will it increase compliance? It takes multiple perspectives to gain a clear picture. According to Johannes Cultures and disciplines must blend to create maximum impact of innovation. Solving old problems with new technology, that is innovative. The concept of diets are not new, but using technology to aid in evidence-based practice and support evidence-based practice outside the hospital and support evidence-based practice diets is new and innovative and requires more research and increased database. Instead of having a piece of paper or a dash diet pamphlet that can be lost, now consumers have the feasibility of having this expanded database at their fingertips anytime, carrying it in their pocket or their mobile phone device. This concludes this presentation on the Dash Diet mobile application technology. Does anyone have any questions? Thank you for your participation in this proposal.